All right. Looks like it's recording as best I can tell.
Please go ahead.
All right. Welcome, everyone. I'm sure more people will join in, but we'll try to keep things moving along since we have quite a jam-packed itinerary for this evening. For those who I don't know or who try to forget me, I'm Chad Teeters. I'm the Executive Medical Director for AHP. I will be your MC, or at least for half of you, I'll be your MC all night. For the other half who may be thinking they're lucky stars, I'll be your MC for half the night. This is really going to be the first effort in the virtual clinical grand rounds world at trying to be a little bit of something for everybody. So in years past, we've tried to cater to specialist versus primary care or vice versa, peds versus adult. And tonight we're going to stick with our kind of successful multiple small feedings motif, but we're going to do a Zoom breakout so that half the group will be able to opt into the peds maternal child health arm, and the other half will opt into the adult medicine arm. For those of you that are immediately torn by that decision and wishing that you could have the best of both worlds, we will be recording all the sessions so that you can go back and view whatever you were not able to attend live at a later time. So do not worry, you will get the opportunity to see any and all of this that you so choose. I also want to take a moment to give special thanks to Renee, as always, as being the behind the scenes puppeteer master and keeping me on track. But then also to LJ Shipley and Diego Conhidalgo, who were really responsible for inviting the speakers and kind of cultivating the agenda for this evening. So thank you to both of them. And I know LJ will be with us shortly, but she is back from her Wi-Fi blockout. She paid her Spectrum bill, so she's here now. So welcome, LJ. So as I said before, you're going to have the option to choose your breakout session. This will not be mandatory or forced upon you. You will have the option. If you are regretting your decision, you are stuck there, so you can't go back once you've made your decision. It's once and forevermore. We will be taking attendance at the breakout session, and at the conclusion of the session, there will be a meeting evaluation, which was the way that you will be able to claim your CME at the end of the night. So please make sure you do that, and if you miss that, then certainly reach out to us by email, and we'll make sure we get that link to you. So general overview for everybody before we break out. So just kind of an update of where we are for the course of this year and where we are going for 2023. So as we do every year, we track our quality metric performance. This year has been a bit difficult. And as many of you know, and as we've tried to communicate regularly to everyone, we've had issues this year with our Arcadia program, both with metrics not being loaded in accurately and the Arcadia program not aggregating data accurately at various points and throughout the year. Because of this, we did not have the same ability that we have in years past to provide that pre-visit planning template. I know, thankfully, after many years, many practices have ingratiated this into their own EMR or their practice workflows. So many were able to kind of work past the Arcadia difficulties. However, you will see that our performance, whereas we are normally accustomed to seeing quite a bit of blue on our grid, where we're above the 90th percentile, you will see that in many domains this year, we are actually seeing red, which is unusual for us. There are multiple reasons as to why. Some of those are new metrics that we took this year in kind of a test drive report only episode, but we didn't get a good chance to work towards them because we weren't able to accurately capture and report data because of the shortcomings with Arcadia. We are now working with Excellis to try to basically cut and paste our grid from this year into next year, given that we really didn't have a running start this year to put a lot of work and effort towards driving performance in those new metrics. For some of the other metrics, such as hypertension control and diabetic control A1C, these are metrics that have been increasingly difficult over time. They were made more difficult during the pandemic. So there is bigger ground to make up, and the entire country has been working to improve this all along. So those are metrics that we continue to put attention and dedication towards, and that you will continue to see efforts in our clinical initiatives to drive performance in those in the years ahead. I will say, despite the struggles, we positioned ourselves well to maximize our gain share in each line of business this year. So while as the clinical savings will not be as robust in a COVID year where we experienced issues with unprecedented census, COVID medications testing that really taxed the budget. From an overall quality standpoint, we did achieve enough points to maximize our gain share potential. Next slide. So, understanding that Arcadia has presented difficulties this year and knowing that all of you experience challenges in your own practices with staffing, with the challenges that COVID presented, especially in the beginning of the year. And I hate to even say that we are emerging into a post-COVID healthcare world because we never really seem to be post-COVID. But nonetheless, we know that now more than ever before, the financial challenges and the staffing challenges that you all are facing are somewhat unprecedented. So because of the challenges we've had with Arcadia, and thank you, Mike, I appreciate that. But with the challenges we've had with Arcadia and because of the struggles that we know this year brought, we, the leadership team at AHP, have made the decision to hold practices harmless for this year and to distribute the gain share equitably. So there will, as in years past, be an attribution threshold so that for practices that have very low attribution, so overall contribute less to the gain share potential, there will be a slightly lower tier of gain share performance. But for all of the other practices, it will be distributed equitably without preconception as to points achieved on the HEDIS metrics. We do anticipate going back to our points performance in 2023, but we felt like because of all the challenges of this year, especially with Arcadia, the only fair way to approach this was to hold practices harmless rather than hold people accountable for things that they weren't able to get timely reporting on. Next slide, thank you. Because of the challenges we've had with Arcadia, Christy Howd and Willie Nugent have led an internal effort to vet alternative data aggregation systems just to make sure that we are in the boat that we want to be in. And so we have been going through the process within AHP to look at competitors in the Arcadia market to see if there are potential alternatives to the Arcadia platform. This is obviously not a decision that we take lightly because there's been a lot of time and effort invested into Arcadia. However, with the challenges that we have faced over the last couple of years, we also know that this is really the table stakes for how we do business and how we provide timely and accurate reporting to all of you. So we need to make sure that we have a good partner so that we can do that and do it well. So we will be continuing this process and then certainly reporting out to you guys if we do plan to make any changes in the year ahead. But certainly if we stay with Arcadia, one of the tenets of that agreement will be that they have to provide better service and better reporting so that we can continue to engage with all of you in the way that we have in the past. Aside from Arcadia, although Arcadia does provide the back support and information, we have been working for the last year or so now on this provider engagement report. This is kind of the next iteration of the reporting that we used to provide to all of you quarterly. And resoundingly, we heard and understood that that reporting was oftentimes not real time, not providing actionable data, and certainly not providing patient level opportunities that you felt like you could act upon. So the provider engagement report is really meant to do two things. Number one, it is meant to be very clear as to what the performance needed to achieve maximum gain share will be, and then also to provide a rubric to demonstrate in real time how you and your practice are performing towards achieving optimum outcome. And that is both in terms of quality, in terms of citizenship and participation in AHP initiatives, but then also in terms of cost reduction strategies that AHP has identified to help optimize our value-based savings. So we are in the process now of doing training sessions for your practices. Some of you have already gone through it, but we really hope that this will prove to be a useful adjunct to and not a replacement for the Arcadia system, but also to be more all-encompassing of the efforts that AHP is engaged in so that you can see how you and your practice are performing to the overall clinical efforts that AHP is trying to partner with you on. We will continue to, this provider engagement report will be pretty set, so we will not be changing the initiatives in the middle of the year, so that when we start 2023, you will know what you are on the hook for, so to speak, both from a quality and cost reduction and citizenship standpoint. And then you'll be able to see in real time with the provider engagement report, both where there are opportunities to improve your performance and how you're performing towards your gain share goal. So we're very excited about that. And we think that that will be the next iteration in our ability to partner with all of our providers and practice teams. And then finally, as I mentioned before, because of the challenges we've had in 23, Excellus is no different. We are working to argue that the quality grid really should remain unchanged so that you will not see any difference in the metric grid from what you experienced in 2022. Briefly for our clinical initiatives, because folks like to see an update of how we are performing. Our 5 contacts readmission program is the longest sustained clinical initiative to date. This has gone very well, and I will say that during the pandemic, although we have faced some challenges both in data because we've had the effects of the pandemic affecting our readmission rates, but we've also been able to use the 5 contacts program to help with our transitional care management of COVID patients as well as for routine discharges. So you can see here, when we look at all patients, our readmission rate largely has been improving over time. The lighter bar has been kind of improving. You will see in May and June, we kind of coursed just above the prior performance, so not as good. But if you look at strong, where the program was somewhat newer, we have exceeded our target performance. Highland, which has been kind of competing against itself, because remember, Highland is where the initial pilot of the readmissions program started in 2019 or 2018, I should say. So Highland has been engaged in the readmissions program for quite some time, so it's harder to beat themselves going forward. But there's still opportunity here, and we anticipate that as our analytics become more robust and our reporting more real time, that we'll identify and further specify which target populations to really focus on in the readmissions effort. Next slide. When we look at our fidelity function, so with each of the 5 contacts, those are 5 separate touch points with various patients who are discharged. You can see that roughly about 70% of the time, we are achieving the outreach as intended. When you're talking about tens of thousands of patients who have now gone through this program, that's actually fairly extraordinary, especially through all the staffing challenges, both on the inpatient and ambulatory sector in your practices. We are still able to complete this 70 to 80% of the time, which I think is quite good. You can see contact 5, which is the last of the contacts at day 21 post-discharge, is the one that we have basically said catch as catch can, because we realize that that requires a sustained engagement that can be difficult to attain, especially when the practice staffing is so low. But kudos to everyone, and certainly our care management team, and certainly our inpatient team as well, who have kind of fought through the adversity of the staffing challenges and the pandemic to sustain this type of performance. Next slide. Osteoarthritis has had fits and sputters, but we have now had approximately 375 patients who have gone through this program. This is both to reduce out-of-network leakage of large joint replacement, but also to improve the quality and outcomes in those patients. We're starting to see more organic referrals into this program, and we're starting to get enough of a quorum that we'll be able to see, are we achieving those desired outcomes of retaining care in network and reducing both progression to joint replacement, but also reducing adverse outcomes. So more to come on this one as we get into 2023. Next slide. So for 2023, much the same. Again, we're not looking to spring a lot on you. We know this year has been difficult. We will be increasing our engagement through the provider engagement report and pharmacy prescribing efforts as always. And then we are looking towards behavioral health integration. George Nazareth is leading this program, and we will be coming out to talk more with all of you about this to help with some of that low acuity behavioral health care in the practices. And we've also had some effort really suggested by many of you looking at leakage for breast cancer treatment out of network, where we've had some recent data that shows the initial treatment can be as much as 7 times more expensive when patients go out of network, and long-term chemo and surgical treatment can be as much as 14 times more expensive when patients go out of network. So this seems a great opportunity to improve care and reduce costs in our population. And I think that is really the last slide. Oh, strategic planning, I was just going to touch on. We are in the process, as we've talked at many vantage points, of going through a strategic planning process at AHP for what will now be AHP 3.0 as we enter into our 9th year of existence. So as we emerge from a COVID world, we look at new strategies for how to improve our value-based contracting and financial performance and delivering care in this new healthcare economy. We are looking for ways to both optimize our workforce and delivery of service to both improve care delivery with all of you, but also improve funds flow as the financing of healthcare delivery changes. So more to come on this as well. Okay, that gets us into our breakout sessions. So on the left side of the screen, if you are so inclined to maternal child health, you will be going into breakout room number 1, otherwise known as the maternal child health breakout. If you are so inclined to the adult flavor, you will go into breakout number 2, and we will be going through introductions of these speakers and within those individual breakout rooms. So at the bottom of your screen, no, mine just flashed. Join a breakout room just flashed up. So you can choose now and forever hold your peace as to which room you would like to go to. And either LJ or I will be greeting you when you arrive there. Thanks, everybody. Have a good night.